Hello, everyone. Thank you very much for attending this workshop. It is my pleasure to present about our team's new development efforts. As Arash mentioned, I'm working at Addiction and Concurrent Disorder Group, which is led by Professor Krause. And today I will briefly introduce RAMP, which stands for Risk Assessment and Management Platform. Our team members have been developing this platform since 2019, and any one of you who would be interested to help in evaluating RAMP and testing the platform, we would highly appreciate that. And please do not hesitate to email me, and we will provide you with the login info and the feedback form. And this is my email. And we appreciate if you all introduce yourself in the chat function. And as Arash mentioned, if you turn on your videos so we can have a little chat after my presentation. My presentation will be about 25 to 30 minutes. So the RAMP idea started by the overdose crisis. I'm not going into the detail of this because the previous session was all about this and the crisis that started in 2015. It started before that. Actually, it was really increasing after 2015, and it has been increasing relentlessly. And even in 2021, more people died from overdose than from COVID. So this was a trigger for the RAMP idea. The rationale behind RAMP is that mental health services for people with substance use is barely available around the world, and only 20% of youth in developed countries get proper care, while in 80% of low and middle income countries, those services are non-existent. In many cases, people have to pay out of their pocket, and most of the funding related to addiction goes to other areas than healthcare. So technology and especially online solution may help to somehow bridge this gap. And this risk assessment and management platform was proposed by Addiction and Concurrent Disorder Group at UBC and was generously funded by Health Canada in 2018. So actually the advantage of RAMP is that it's a learning system, it's an open access system, it's integration easy, and the major focus and approach is empowerment, so users empowerment. There are 4 core elements: informed decision making, assessment and goal setting, risk prevention and management, and recovery. So I'm now explaining the approach. This approach is for now for the high-risk substance users and overdose, but we can expand it to the other domains as well. So the approach is that by promoting the platform, and I mean by any means, for example, promoting platform to social media, conferences, and by other means, users will visit the platform. And then by introducing some features that are even available before the registration, we hope that the users are getting engaged and registered. So when they register, HRA is proposed to them. HRA stands for high risk assessment. And this is the core element or the heart of the system. It's a tool that helps people to identify their risk of overdose and high risk substance use. So this is, when they do this assessment, there is a decision support system, means that there is a computer system that based on the result can offer them some education and information, namely some modules, and also other assessment if they need. And of course, more importantly, some goals and health tasks, which the health tasks can be behavior management technique, activities, behavioral therapies, symptom checks, and other things. So when they start doing this kind of interventions or this help task, then the system will track them and they can see their progress via a monitoring system called live chart. And then regular reminder will be sent to their emails. And then this improvement cycle starts again with another proposal of HRA to the user, and it goes on. So some technical specification of RAMP. RAMP is a web application responsive to mobile devices. The content management system is using WordPress, and it's available via ramp2.walkalong.ca, and currently the beta version is password protected. So by entering your username and password, you can log into the system. So there is a 1-minute introduction about RAMP for the first-time users on the login page. And then when you log in, this is the page that you will see. This is the home page. So on the right part of this page, you will see help in crisis. So, and you can find resources in emergency and crisis. In the middle, it's the My Journey page, which summarizes your interaction with RAMP. And we will briefly talk about it later. And on the left side, all RAMP features are on a vertical menu. So we will introduce them in this presentation, and we will start with assessment. So if you click on the assessment, you will see currently we have added 3 assessments. We can add other assessments based on the domain that we want to approach. So the main assessment that I will talk about it is high-risk assessment, which, as I mentioned, is the core element of the system. So this is developed by the ACD team under the supervision of Professor Krause. And so if I click on high-risk assessment, then I will be taken to this page. So I can see the latest HRA results. For example, here I twice did the assessment. First time, my score was 46, and second time was 44, and which both of them are very high, and the latest result is shown on a heat map. And here it shows also my latest result and the highest result and the time span. Also, I can start a new assessment. I can modify my risk, or I can emulate my risk, or I can get information about my risks. And so if I want to start an assessment, so here I will get a set of questions, mostly yes and no questions. Some of them have tally question. For example, this question number 6, if instead of no, I say yes. So I will see that there is another question that asks for the kind of mental health illness based on the symptoms that I'm saying that I had. And if I answer all the 29 questions, then a page will be shown to me that speaks about my risk. So it shows my result. It shows that the risk level. For example, it shows that in this case it is high, and what does high mean? And it also recommends me some module based on the results that I have from the high risk assessment. So high risk assessment for this reason is the core of the system, because recommendation of modules and recommendation of goals, it will also recommend me the 2 most relevant goals. Recommendation of these modules and goals are all based on the results of this HRA. It will also recommend me to emulate or modify my modifiable risks. And if I click on this link, and what does it mean? If I click on this link, then some of the questions are, which are actually the risk factors, some of them are modifiable. For example, in this case, you can see that there are 2 heat maps. One is before modifying any risk, and one is after. Currently, they are the same because I haven't changed any question. For example, if I change the answer to this question, I was saying that I have been using fentanyl. But what if I say that, no, I wasn't using? So it shows that here, the risk has been reduced from 44 to 41. And for example, here, if I am enrolled in an OAT, opioid agonist treatment, and instead of no, I say yes, then it shows that my risk will further reduce to 38. And in this way, by playing with this modifiable risk factor, I can gain knowledge about what are the most important modifiable risk factors and try to set some relevant goals to mitigate those risks. So this is also a great educational tool. So the next section that I'm talking about is modules. We have some general module like COVID-19 and positive psychology or problem solving, and some more specific on substance use like this naloxone opioid overdose safe injection, and they're speaking about the symptoms, treatment, and those kind of areas. So if I start with one of the modules, for example, the substitution treatment, this is the page that I will see. There is an introduction. It can be a combination of video, text, and animation. And also there are module content is categorized in lessons. So for most of these educational modules, they have lots of lessons, and then there is a quiz and frequently asked questions. Some of the other modules may have more activities for those that they are interactive, those that they are they're introducing some interventions. They have more approach of to have more activities there. And so if I go to one of these lessons, I have a bit of text and also some videos, or even sometimes our team members have developed animations and cartoons to explain things visually. And all trainings are competency-based, and you can test your knowledge at the end of the module by entering into the quiz section. And there, as I mentioned, there is a frequently asked question available there. So the next section that I'm speaking about is the goals section. Goals are in, if I enter into this page, I will see those goals and the health tasks that are already set for me. So I have already set them before. And the goals are in dark blue, while health tasks are in light blue. And health tasks are, as I mentioned earlier, are the objective interventions and those that are smart, and we want to measure them. You can set goals by clicking on add new goals. So if I click on this, then I will see 4 focus areas. That currently we have 4 focus areas. Those focus areas that appears with a little star are those that are recommended by the system to set some goals. So they contain goals that are recommended by system. So for example, we select this overdose risk behaviors. This one is grayed out. So there are 3 goals here. This one is grayed out because I have already selected. You can see in the background that this goal, be safer with my drug consumption, has already been taken. So I will select this one. I will select be safer with the drugs I mix. Then it will show the health task, and I'm selecting this one, going to safe consumption sites. So if I click on this, then it will show the frequency and also if it is daily or weekly. For example, in this case, I have selected 3 and weekly, which means that I want to go to safe consumption sites 3 times a week. And when I click on the next, then I will see this goal with the first health task is added. If I want to add new task, I can click on this one, and then it will show this box again. So this one is grayed out because I already selected, and I can select other health tasks in the same way that I selected the first one. So there are also this minus, plus, and minus, which I can it register or undo completion of a health task, and it's a self-report. And then it will show here the results and also the percent of completion. For example, if I do once, it will show 1 in 3, and it was weekly. It can be daily, it can be weekly, and based on this, the progress will be recorded. So I can also see my progress for one health task using this icon. If I click on this, then for example, for this one, I can see that on this specific days I was doing it, but for example, on the 20th and the 24th, I have done partially. Instead of twice, I did it only once. And on 21st, I did it completely. So I did two out of 2. And I can undo a goal if I don't want to work on it, or and archive it, or I can unarchive an already archived goal and bring it back and work on the goal and the health tasks. The next feature that I explain is symptom diary. So symptom diary is where you can check your symptoms on a daily basis. Currently, we have included 8 domains, but we can easily add other domains if necessary. Here we demonstrate depression, and other domains have a similar page and similar demonstration. So I select depression, and when we go to this page, the page will show your latest results. So on this top figure, it will show the total number of symptoms, while the lower one shows your symptoms, your present symptoms as color coded. For example, this green represents thoughts of hurting yourself or death wishes. So in this way, if I do it along the week, I can see how many symptoms do I have every day, and what are those symptoms along the week. I can also, if I start a symptom check, a depression check, then I can register this. For example, saying simply yes or no. These are yes/no questions, and then I can submit it, and then this will be recorded as another registration of symptoms. So I can track my symptoms along the time. The next feature that is here is live chart, which I explained is our monitoring system. So in live chart, you can it allows you to monitor and compare several subsections in one graph. So we have added symptoms, assessment, and goals. In this graph, I have been comparing symptoms and assessment at the same time. For example, on the 22nd, which is a Saturday, I can see these are my symptoms, and while my HRA was at this level. So at the same time, I can compare some things, or I can use these tabs to just compare the subsections of each. For example, I can see what are my present symptoms or along the time, or what are different health tasks of one goal in this week, or I can compare the goals. So this live chart allows me to compare different components of the system and track my progresses. The next section is actually art with a meaning. So art with a meaning is a place that you can express your emotions and feelings by reflecting on paintings and pictures. You can reflect on others or share yours with others. And this is a moderated area where things will be published after they are reviewed by the admin. And if I select one of these pictures or the pieces of art, then I can comment. For example, I can reflect on things here, and then these comments will be published here, and people can talk and share their ideas about this piece of art. And also I can, in addition to liking that, I can add it to my favorites, and it will be added as part of the favorites. It is also this section is categorized, so in some categories, and we are further working on this section to really create an environment for kind of non-verbal communication and reflection of thoughts and emotions. So the next part is actually journal. So the journal is a place that you can write your diary. So a diary can be your reflection about different topics. We're currently working on adding a symptom diary also to this journal. But currently, these are the questions and the way that you can reflect on your day and mentioning about your day. So we have also some projects together with the computer science department to really do some kind of NLP, natural language processing on the content of this part, and further analyze the results to create some actually engines. And this is actually the My Journey page, which I explained earlier. So if I don't know if it is visible or not, but I can probably turn off this so that it is visible. So you can see what kind of interaction you had with different parts of the RAM. For example, it concludes your interaction with the risk assessment, high risk assessment. It says what is your total score and what's the last update, and what about PHQ-9, about GAT7, and if we add other assessment as well. Also, it says that what kind of interaction you had with the module and what are the modules that are suggested for you. And also, it also says about my goals and my symptoms, the goals that I have set and how many times I have done them. Also, what kind of symptom checks I did, and what was the last day that I checked my symptom. And also about my interaction with the journal section. So there are also email reminders that summarizes your interaction and send it to your email weekly. And you can see your interaction with different parts, and also again recommended modules and your journey, and we'll send it every week. So this is also a part that we call it resources or navigation of healthcare. Our team has put lots of effort on developing this. So it uses Google My Map, and currently we have done this for Vancouver, but it is possible that we can do it for other areas, and because it's using the Google Map, the map of this Google Map. And for example, here, I can select multiple services or deselect them. I can zoom in and I can see the services that are around me. The services are mental health services, addiction services, residential treatment centers, hospitals, urgent care centers, walk-in medical services, housing services, victim support services, phone support services, and many more. So for example, here I can select them and or deselect them, and I can go on this or on any location and click on it, and I will see an explanation of this center and the contact and the time that they are having the service, and those kind of information. And this has been updated by our team regularly. So this is also a great resource that people can use to find services around themselves. So by introduction of these features, I will end my presentation, and thank you very much. Uh, we are now entering into the QA section, and we would love to hear from you and learn from you, and really collaborate and listen to what are the comments and how we can improve the system. Thank you, everyone. Thank you very much.